8:11 now. I'm JT. It's Wednesday morning as we get through this morning together. Thank you for making us part of your day as you get things started. Well, Obamacare is about ready to hit us all in the face, and Governor Bentley is saying, no, I don't think so. We're not all about that here. We're going to stay away from this. And Dr. Paige Powell, who is at UAB with the Health Services Administration there. Dr. Powell, Obamacare, the governor's saying, not real good for us. Is there anything about this plan that makes sense here for us?
Well, if states don't choose to go with setting up their own exchange, then they lose any flexibility that they have and to cater it to their population's needs. However, a lot of states are choosing not to go and set up their own exchanges because the Affordable Care Act is very prescribed and really has a lot of minimum requirements that states have to comply with that a lot of states think are just really too difficult.
Yeah, and they've got the Friday deadline coming up, and is this coming whether we like it or not, or is Governor Bentley's plan to say no and push back just going to delay the process, and we're still going to end up having to play ball?
I have a feeling it's coming whether we play ball or not, and it's not even going to delay the process because the federal government will come in and they'll set up their own exchanges, and people will still have to purchase insurance. It just won't be catered as much to Alabama's needs as a state health insurance exchange would.
The whole bottom line of this is, forget the fact that you're going to have to stand in line and not get medical care the way you think you'd want to in a socialized medical setup. But the money, the bottom line is the dollar. And Governor Bentley says this is going to be a $50 million, problem for us. And what's going to happen when the feds come in and say, okay, fine. Companies, you got to provide insurance for your employees. You people that don't have health insurance, you need to go get it. What happens when I say, look, I can't afford it, I can't do it?
Well, then you have to pay a tax penalty if you choose not to purchase insurance. That is what the law is going to say. And for companies who don't purchase insurance for their employees, if they have over 50 employees, then they have to pay a penalty as well.
We've seen it happen already. I mean, the president wasn't back in the White House for a week, and people all across this country that have small businesses are laying people off just because of this. They're saying, look, it's coming. I'm not going to be able to afford to employ, let's say, 50 people anymore. I've got to cut that workforce in half. So, sorry, 25 people of you got to go, and you're fired. See you later. So, to me, it seems like this whole thing with Obama coming in with this, we're going to get health care for everybody. The people that voted for it are going to end up getting bit in the butt in the long run. Do you see this happening?
To some extent, yes. But those people who make between 100 and 400% of the federal poverty level are going to get very generous subsidies to purchase insurance. I mean, they're not going to have to pay but between 3% to, I believe, 9% of their income in premiums, and the rest is going to come from federal tax dollars.
Yeah, which is coming from me and you.
Correct.
Yeah, so these people that have worked their butts off their entire life to build their incomes to the point where they're comfortable and can afford to buy their own companies and hire people are now going to say, fine, you want to do that? I'm going to have to fire people, and my business is going to suffer. And I just think that people that have voted for this, thinking that this is the best way to go, don't really get it. Do you see ignorance in the play of the voters on this?
Well, not only the voters, but many of the people who voted for the law. I mean,
yeah, that's what I mean.
Celeste yourself said, you had to pass it to read it. A lot of people didn't see the hidden taxes in the law in terms of insurance companies having to pay taxes to support the reinsurance fund and other types of things, which is going to cause an increase in premiums to those who have private health insurance. So, there's a lot of things that people didn't know about, and we're still not sure about a lot of things about how the exchanges are going to work.
And there's no way. I mean, what's Governor Bentley's options here? Are you in favor of what the governor's doing, trying to push back on this, first of all? And secondly, and like we both just mentioned, that it's probably coming whether we like it or not. Are the courts going to get involved in this, or is this not even an option?
The courts have already decided. I mean, this was what the individual mandate argument was about. I really would rather have Alabama at some point at least try and establish their own exchange and hopefully through the regulatory process or through Congress try and get more flexibility. Where what a lot of states are doing now is trying to get more flexibility in advance before they agree to set up their own exchange.
Yeah, I think. Go ahead.
I was going to say, if you have 30 states that have a federal health insurance exchange, then what's to stop the other 20 states from saying, okay, well, let's just let the federal government do it as well.